We can't get you, please.
Good evening, everyone. My name is Juno Larissa, a final year student at the University of Goya, and I'm a volunteer at Wem'Afrika.
It's nice having you with us, ma'am. Thank you very much for introducing me. Madam, oh, she left. Okay, I will just proceed. It seems people keep joining and leaving. I don't know why. So we'll just proceed. So our topic for today is the impact of abuse and neglect on preventive health care and medical access for the elderly, which will be presented by Madame Lum Natalie and Madame Pauline. Permit me to introduce Madame Lum Natalie to you all. She's a passionate humanitarian, gender advocate from Cameroon with plus 6 years of working experience, implementing projects funded by different organizations like UNICEF, ECHO, and Swiss Agency for Development and Cooperation. She holds a BSc and MSc in Gender Studies from the University of Buea, Cameroon. Her drive towards women empowerment has given her the opportunity to implement several award-winning projects. She is currently the executive director of Dorothy and Cecilia Memorial Foundation, an organization that strives to foster gender equality and support the elderly in Cameroon and beyond. So, ladies and gentlemen, kindly welcome Madame Lum Natalie to the floor. Madame Lum, you're welcome. You can just use an emoji to welcome her, please.
Thank you so much, Mrs. Nuki. Thank you so
You're
much.
welcome.
Um, I want to share my screen. Let me try to do that so that we will all take part in the presentation. What I have here is a very short presentation. Um, okay. This I'm trying to share my screen. I think I'm having challenges. Uh, okay. I'm having challenges sharing my screen. Okay. So just so that I don't waste so much time, I just want to be clear if everybody is getting me.
I can get you.
Hello? Okay. I'm trying to share my screen, but I'm having challenges. So I hope you will not mind if I just do the presentation without having to share my screen, and then I could share the slides later.
Yes, that's
Is that
okay.
okay? Okay, thank you so much.
Can you try again? Because we tried to work on the settings.
Okay. Um, no, I still have challenges doing that.
Okay.
I still have challenges. Um, I don't know how we can do this. Probably if I had shared my slide with you, Mrs. Nuki, earlier, I think you would have helped me to. You may have helped me to share my screen right now. Oh la la. Oh
No,
la la.
maybe you can just
I'll
send it
just.
to me.
Will you want me to share with you? Will you want me to share the slide with you right now so you can share your screen and then
Yes,
I do the presentation from there?
yes, ma'am.
Okay, let me quickly do that. I'm doing that immediately. Mm, okay, I'm doing that. I'm sorry for the delay. Just mute myself so that I do this right and then I get back here.
Mom, have you sent it already?
Okay, I just shared. I just shared it.
Mhm. Can everybody see my screen, please? Is it visible?
Yes, it is.
Okay. Madam Bloom, I think you can commence now. Madam Bloom, are you there?
Okay, I'm here. Can you get me?
Yes, I can get you. I don't
Okay,
know.
okay, 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 okay. Hello, everyone. My name is Lum Natali Akum, and I'll be doing a presentation on the impact of abuse and neglect on preventive healthcare and medical access for the elderly. And just to give us a tip of what we should expect to see in the rest of the slides will be the outline, which is the outline that's going to range from the introduction through to the conclusion. And as an introduction, I would like to say that this webinar or meeting is of prime importance to me in particular because it handles a critical issue which affects older people. And that critical issue is abuse and neglect. And when we talk about abuse and neglect, we are looking at how it impacts their ability to access preventive health care. And we are also looking at how it affects their ability or impacts their ability to access medical services. So the importance of this topic is based on the fact that elderly people are very, very vulnerable. And when they are not treated well, it tends out to affect their health and their overall well-being. So if we are analyzing or we are looking at if we are looking at the impact of abuse and neglect on preventive health care and medical access to for elderly people, it will also be important that we should pick out keywords for example, neglect and abuse. So I think that we should start by understanding what abuse is, what neglect is, so that it's going to guide us through, ease our understanding through the rest of this presentation. So, um, abuse can take many forms. Abuse could be physical, abuse could be emotional, it could be financial, it could even be sexual. And neglect, on the other hand, is failing to provide necessary care, which could be food, which could be medication or medical assistance. Studies, however, have shown that about 1 in 10 elderly people around the world experience some form of abuse or neglect. And this greatly affects their physical and mental health, which is the reason why we are here today. And if this affects their physical or mental health, then we should already start looking at the impact on preventive care. What is the impact on preventive care? Impact number one will say that we should always we should ensure that these people always have regular checkups, screenings, and vaccinations that would help to catch diseases early or prevent them altogether, owing to the fact that earlier slides have mentioned how vulnerable elderly people are. And also, as a second point on impact on preventive care, we see clearly that when elderly individuals are neglected, they are less likely to receive care. And a lot of times, as a result of fear of the abuser, abandonment, lack of support, it often it stands as a major hindrance, from allowing these elderly people to get care, medical care. I would like to note here that because we have said that elderly people are vulnerable people, we are also insinuating that, or we are also seeing the reality that in most cases, elderly people cannot take care of themselves, so they are totally dependent on other people. Which means that if we are talking about elderly people, we should understand that it is of prime importance not only to talk about elderly people, it is also important or more important to talk about their caregivers, which in some cases may become their abusers. And if these caregivers are abusing the people, the elderly people they take care of, then that is where we are going to have all these challenges that we are talking about. That is where we are going to have the challenge, the challenge of or the likelihood, high likelihood of them receiving medical care. There is a high likelihood that they are going to miss medical appointments. They'll miss out on screenings, on vaccinations, and as a result of that, they will easily fall sick. There are many things we'll be unable to prevent, and then that is how the circle turns and turns and turns. So, I may have just taken ourselves, I may have just gone really far to talk about um, elderly care support. But just to bring us back online, I would like us to look at the impact, you know, on medical access. When we talk about access here, we just want to talk about access here in the main sense of it, as in access meaning your way through. Access here could just mean your means of transportation. That is how easy I want us to understand access. So we are saying here that neglect here might mean that elderly people lack transportation, which is what I said, access. May lack transportation or assistance to get medical facilities. And on another hand, we are saying that that it is even worse. It is worse because abusers might intentionally block their access to healthcare, to maintain control or conceal the abuse. That is why I said that there is no way we can talk about elderly support. There is no way we can talk about taking care of elderly. And if we all acknowledge that they are vulnerable, then we should know that their caregivers have a very big role to play. And sometimes caregivers may be their abusers. No. So I'm also saying here that financial abuse can limit their ability to pay for treatment. So we are saying in a situation where the caregiver does not support you financially, this may greatly limit your ability to pay for treatment or medication. And also all these barriers that I've mentioned, they result in delayed care. They result in the fact that caregivers are delaying to offer care, or they are just not offering care enough, which will lead to worsening health problems and sometimes hospitalization, which could have been avoided. So, straight away, I would like us to look at why is preventive care important? Why is it important for us to prevent all of this? Why is it important for us to take measures to ensure that elderly people stay healthy, that they stay protected, that they stay comfortable? If we understand that preventive care is vital for maintaining health and independence in older adults, then we will also know how well it helps to manage chronic diseases, how well it helps to prevent new illnesses, and how it improves the quality of life. When abuse or neglect stops, when abuse or neglect stops elderly people from accessing the services, their risk of serious health complications and even death increases very, very significantly. Thus, I'd like to just conclude by saying that abuse and neglect among elderly have a deep and harmful impact on their access to preventive health care and medical services. So, it is therefore essential for healthcare providers, for caregivers, and the society in general to recognize the signs of abuse, and not only recognize the signs of abuse, but they should work together to support and to protect vulnerable older adults. By doing so, we can help and we can also ensure that they receive the care they need to live healthier and safer lives. So this is it for my presentation. Thank you so much. I'm quite open for discussions with regards to this. Suggestions, questions. I am quite open. Thank you.
Thank you very much, ma'am. Thank you for enlightening us on elderly care. I think we'll have questions by the end of the second speaker's presentation. So if you have your questions, please note them down and
Okay, that's fine.
all right, ma'am. So our second speaker is Madame Pauline. Madame Pauline, are you there?
Yes, I am.
Okay, thank you. Permit me to introduce Madame Pauline to you all. Madame Pauline
Yes,
is,
yes.
sorry, ma'am, I'm trying to,
Oh,
I want to introduce you first. She is the co-founder of Wem'Afrika and is presently working in an area of nuclear security. with a passion for international security, policy making, and conflict resolution, with over 5 years of working experience in conflict resolution. She thrives on embarking on a journey in nuclear security and nuclear safeguard, which involves commitment and comprehension from the institutions and community. Ladies and gentlemen, kindly welcome Madame Pauline as our second speaker for today. You can have the floor, Madam.
Thank you
Yeah.
very much, Claudine. I think I've shared the screen, my presentation to you. Let me share that with you again. Have you received it?
Let me check. Not yet.
All right, let's see. I think it's my computer. Just so done. Just a few minutes, please. Have you received now? Good. I think let me send it through WhatsApp. Maybe it's better.
Not yet, ma'am. Maybe it's still loading.
Thank you. Received? No?
Let me check.
Because I face the same difficulty. I don't know if it's my computer.
Not yet, ma'am. I haven't received it. On WhatsApp, right?
Yes.
I haven't received it yet.
Do you know what? We'll just go like this. I think we'll just go. Let me see if I can share with this platform. Oh no. Oh no. So, my topic today is policy advocacy for mandatory training for health personnel on either abuse and neglect, identification and response. My apologies. It's not there. Greetings to everyone. My apologies for the internet connection. I don't know what's happening with my computer. I don't know, but I'm going to give an oral presentation. Thank you so much to Claudine for the introduction. Thank you to Natalie, for your insight about abuse, elder abuse, and neglect. So my own approach would be from the policy approach in ensuring that health personnel are being trained on how to identify and respond to child abuse. I'm sorry, to elder abuse. As Sheila mentioned, Natalie mentioned about the different signs of elder abuse, the physical, the emotional, the financial signs of elder abuse. And most of these abuse have been perpetrated by those they trust, by the individual they trust, either the caregivers or their family members. Most of the activities being done, or the most of the abuse by the elder abuse are mostly the financial one, whereby the caregivers or the family members or these perpetrators tend to take advantage of the elderly account, the fraudulent signatures on financial documents, or rather they just do unusual spending on the elderly account. So are things that we have to avoid. And when we look into the context of the African context as well as the European or the Asian context, it's quite different. Claudine did a research on the Bamayu community, and from her research, she stated that most of the people who take care of the elderly are the family members, and these elderly individuals are on retirement. So therefore, most of the financial burdens comes to the family. And when it comes to the community, how do they approach the elderly? When we look at the African culture, it's really approach, they really consider it. But in terms of the caregiving, especially with the health care, do they really assist? Do they really help? Let me take for example, with regards to dementia. I know we are aware of dementia, but how do you approach dementia? Many people think it's more of a mental problem. We think, it's madness. It can't be cured. It can't be controlled. It's normal within the other abuse or within the other adults. But if the communities are aware about what's happening, or the caregivers, people have been trained, if it's been emphasized, especially in educational settings, not only those who are willing to work in the healthcare service, but if there are sectors whereby these individuals or these people are being educated about what is elderly, because all of us, each and one of us, want to be an adult or an elder, so we have to be prepared of what's happening, prepare what is going to be happening in later years. And let's note that after COVID-19, there was an increase in the elderly abuse. Why? There was many people had to stay at home. They felt the boredom. They did not feel really comfortable with staying at home with your parents or those who are elderly. And let's know that when it comes to the elderly abuse, let's look at it from two approaches, which is the community approach and the institutional approach. From the community approach, it's this elderly live with us, the elderly live within the community. And look at from the institutional approach, the elderly live this elderly live in a community, in a home, which is called an elderly home, hospice, where these people are being taken care of. Their parents, their children tend to leave them there at this home where they can be comfortable with their peers. And when we want to approach now the elderly abuse from the community point of view, and the institutional part of it, there are two different ways. The community part of it, most of the abuse have been perpetrated by these individuals, by the caregiver, not the caregivers, but the family members or their guidance beside them. And are these people really trained enough? Are these people really educated on how to care for them? I understand it's our parents. I understand it's people we love, and we tend to take care of them depending on the way we feel it's appropriate. But we know that in every stage in life, in every stage of a human being's life, there's a particular knowledge you have to understand. For example, as a newborn, sorry, as a newborn, a mother would just put to bed. Yeah, she knows that that's her child, but does she goes for training? Is she being told on how to care for the baby? Yes, of course. Why shouldn't we implement that with regards to the elderly? Should they be trained? Should they be taught on how to take care of an elderly? Should they be aware of certain emergencies that occurs? Is it being implemented? No, I don't think it's implemented. If it's implemented, but when you look at the result of all the consequences of what's happening out there, it's quite little. So we'll look at it from the approach of the institutional approach. The caregivers, who are the caregiver? Who are the social workers? Okay, yes, it's a home. People want to make money. People want to take care of them because they have money. Yeah, whether no one is watching at them, or if they are watching at them, to what extent, how patient are they? How should they respond to when there is an abuse, or how should they react when there is an behavior, a behavior attitude? How should they attack to it? How should they respond? So if institutions or if communities are educated on these different dimensions on how to care for these elderly, then there's a possibility that these elderly will be very comfortable to express themselves, to live freely, not be living in fear. So my next presentation is about the percentage. I wish I could share my screen. The percentage of these elderly of these different abuse cases. So in regards to the psychological abuse, this my report coming from WHO. In regards to the psychological abuse, we have 11.6%. Why for the community approach 11.6%, while in the institutional approach is 32.5%. With regards to physical abuse and financial abuse, we have just hold on. Oh. With regards to the physical abuse and the financial abuse, we have 2.6%, and with the institutional approach is a 9.3%. With regards to neglect and sexual abuse, we have 4.2%, and with regards to institutional, we have 12.0%. So from these statistics, we realize that with regards to the physical abuse, it's often happens in the institutional approach in the caregivers' homes, the elderly homes. When it comes to neglect and sexual abuse, it still happens in the institutional homes. And when it comes to the physical abuse and the financial abuse with regards to the community, it's low because they live with their loved ones, and it's not really perpetuated, unlike when it's in the institutional approach in institutional organizations. So when it comes to reporting in terms of the intervention and the education, we have to look at it from the perspective of the adult. Who is the adult in terms of the gender? Is it female or male? Is it a female taking care of a male adult, of an elderly, or is it a male taking care of a male? When it comes to gender, women are more nurturing. So people would prefer staying with the female, or prefer a female caregiver. I'm sure based on my own experience, I will see that when our parents are not feeling so well and not feeling good, they prefer to stay with their daughters than with their sons. I'm just saying based on my own experience. It depends on you. It depends on your experience. Would say that most parents who prefer staying with their daughters. Why they say, oh, their daughters will be more nurturing, the more caring, and will be more comfortable in that place. So you as a child taking care of the elderly, what are you doing? What are the things you are learning? Do you just think about your mind? You just depend on what your mind tells you? Whether do you read books? Do you try to know about the laws that protects these people? That if you violate them, even though they're your parents, are you aware that there are laws that would complicate you if they have been abused? Also, it comes to regards to the training. With regards to training, what kind of training are you doing? Do you just focus on the physical? Do you neglect the emotional? Do you neglect the financial? What about the exploitations? Do you also think about that? So when you look into the policy making in terms of the advocacy for these elderly people, always make sure that all these aspects are included when you're taking care of these people. So when it comes to now with the institutional approach with you in terms of intervention and awareness and education. I would recommend that there should be cameras, and there should be cameras, and these caregivers should be trained all the time. They should be aware, they should be told that you are taking care of someone, you are being paid for, so therefore do your duty, even if they are reluctant, even if they have behavioral functionings, behavioral actions. Please try to be patient with them and teach them coping mechanisms on how they can be able to interact, how they can be able to accommodate these elderly people. Sometimes it's really difficult to really take care of them, but when you are being trained and being educated on how to take care of them, there is a way in which you can really talk to them, can really manage the situation. So with regards to the reporting laws and reporting laws, the WHO has delivered a, let's see, in the PDF documents. So the WHO has done a lot of research ensuring that these people are being protected. And how should we do that? They gave out five priorities on how we can tackle the abuse of older persons, which how to combat ageism. That's the major reason why abuse of older people receive so little attention. So that means you should approach ageism with comfort, with happiness. And also let's know that even though these other people are being if people are being abused, another thing it's these elderly persons sometimes don't have knowledge about what happens to their body, and they are not even aware they are being abused, but rather they say, because I am old, I don't have the strength to express myself, it's my fault that I'm old. Rather, you should let also educate these elderly about what's happening to them, to know that this is an abuse. Please, it's not something to tell you that they should go against who they are, but rather it's for you to protect them. If you are able to take off a different group of people in a community, different sector, which are the male, the female, the children, the elderly, these different sets of people from different dimensions, there's a way that the community will build at peace. But when you just tend to just focus only on the children, focus on the women, there is a sense of discrimination. There's a sense where these individuals don't want to be included, and they start being radical in their actions. Another priority we should focus on is about raising funds. We have to raise funds for this elderly. We have to raise funds for this elderly. The 15th of June, it's the day for elderly abuse. So this webinar, it's really a very pertinent a webinar to talk about elderly abuse. So we have to raise funds for this elderly, support them either financially in regards to their health, either in terms of their daily commodities, their daily lives. You have to support them. Or we have to bring out create ideas whereby they can connect with their peers and feel comfortable. And another approach that the WHO spoke about, we have to develop scale up cost effective solutions to stop abuse for elderly persons. And another approach is set about to generate more better data to raise awareness about the problem. So in conclusion, abuse of older people is expected to increase given the rapidly aging population over age 30, age of 60 years and older, and abuse leads to severe physical, mental health, and financial and social consequences in the society. So my goal or my approach, or I want us to think about it from a policies point of view, where we should be able to support these individuals. We should be able to identify reports. We should be able to develop a data whereby raising awareness about this elderly abuse, creating an awareness for the perpetrators to know that if these people are being violated, they will be responsible. They will face the law. And when we are able to ensure that these people are being validated and being supported, the outrage of their mental health will reduce, their depression, their anxiety will reduce. And let's remember that when you are being loved by people around, when you are being supported, you are being provided for, your lifespan increases. But when that's not possible, your lifespan reduces. Sometimes it's just by of frustration. There's people just want to just die or do some activities. But if we create a community whereby these people have been supported, these people have been understood, then the community or these aging people or this abuse will be reduced and then neglect. Thank you. I hope it not takes a lot of time.
Not at all, ma'am. Thank you very much for giving us an insight on this. So, anybody, do you have any question to all of us here? Do you have any question? Yes, Madam Link.
Thank you so much. I just wanted to, not really a question, but just to add my voice to what Madam Pauline said, and to say, first of all, that she did a very wonderful presentation. And the reality on the ground is that the sector of, or the percentage of organizations that actually give regard to elderly and elderly care and support in general, I don't think it's up to 10% here in Cameroon. But when we look at the matter, when we look at it in depthly, we see that there is a high need, owing to the fact that Africa, and Cameroon in particular, does not have particular homes that are set aside for elderly people, which means that elderly care is solely in the hands of family members, or if not family members, nannies, if I may put in quotes, outsiders that are paid to do that. And just like Madam Pauline said, a lot of these family members who come in as caregivers, or whoever is being paid to take care of these elderly people, they don't have the knowledge. They don't have training on what it takes to take care of an elderly person. I am talking with so much experience. I I solely took care of my grandmother for the last 5 years of her life, say from 95 to 100 when she died. And I must say, this is draining. It is time consuming. And as a caregiver, if there is something you lack, you should not lack patience if you're taking care of an elderly person. So the presentation Madame Pauline gave, it spoke a lot to me as an individual. First recommendation is that we should have a network of organizations that advocate for elderly support. If we can have a network of organizations, then we can all see how we can put our voices together to already start kicking against abuse of the elderly people. Secondly, if because she mentioned the idea of us, she mentioned a very powerful point here of reporting mechanisms. It is important, if we come together as a network and then we have reporting mechanisms, then we'll be able to understand what which organization is doing to support the elderly, where, when, and how, and then what resources are needed to continue this support. So there is always a first meeting. I think that from this meeting, we can maybe have discussions in the background to see how we can already start working towards creating such a network. And then I also want to talk about point B under reporting mechanisms. You, Madame Pauline really made another very strong point here, that she said that we could have cameras, or we could already start doing some form of sensitization, awareness raising on how elderly people can report. Now, when we take into consideration that elderly people may be in the place of reporting, well, it is a very good thing to happen. But when I look at it on the other hand, or I try to see the reality of it, the reality is that most of these elderly people are very vulnerable. What is common among elderly people in Africa and Cameroon in particular is dementia. That means that these people, they don't even understand themselves anymore. They don't recognize themselves anymore. They don't even feel that they are being poorly treated. You just see that elderly person being drained. You just see that elderly person being abandoned. There is also some stereotype. There is so much. There is a very huge stereotype that goes on, particularly in Cameroon, the northwest region where I come from. I've seen it in parts of Douala as well, where say you just get up in the night and you see an elderly woman somewhere along the road. She's been and she cannot identify where she's from, where she's going to. She's already been tagged as a wish. These are stereotypes that, first of all, we need to break them. We need to understand that when you suffer from dementia, there are times that you will not remember where you are from, where you are going to, what you are doing at the place where you are doing. So not all of these people moving out on the road who are lost are witches. So if we can, like, these are the kind of points that I think that our network should already be doing. you know, Aside from putting cameras, but we should also look at the point that it is going to be very challenging to have these elderly people come to report to a particular authority by themselves that they are being poorly treated, because these are people who are so vulnerable that they no longer understand themselves. So I think that what we should do on the other hand is that we should do some level of high sensitization and awareness raising campaigns, not only for elderly, but we should focus on their caregivers. We should already start making them to understand that if you don't treat this elderly person right, this is what is going to befall you. The importance of treating them right, the blessings that even come with taking care of elderly people. So if we want to start handling challenges that come with being an elderly person, we should if we should shift our focus to their caregivers, because it is through their caregivers, every like Madame Pauline mentioned earlier, that that a majority of the forms or the different kinds of abuse that they face, it is from their caregivers, which could be family members. So if we can, if we are talking about some sensitization here, I think that emphasis should be laid on caregivers, and then we should also look at possibilities of doing some kind of psychosocial support for the caregivers, owing to the fact that taking care of an elderly person could be draining sometimes. So if we can do some kind of psychological support, we understand the fact that you are drained. You may need to talk to us. You may just want to tell us about the challenges you're facing, so that we can do you some kind of counseling and a little form of case management. So if we should already start looking at things like this as mitigation strategies towards combating elderly abuse. I have so much to say, but I think that we will have another opportunity some other day to talk more and also to learn more. So I am just going to leave it here, and I'm still saying a big thank you to Madame Pauline. Her presentation was very, very, very wealthy. I learned so much. Thank you so much. Thank you. Over.
Oh, thank you very much, ma'am. And to add, I would really say that there's a lot of blessings which come with taking care of elderly people. Yes, it requires a lot of patience to, as a caregiver, to take care of elderly people. But when you think of the fact that maybe you are related to that person, it will really give you that anxiety to take care of that person when you are related to the person. But when you are just somebody that doesn't know that elderly person from anywhere, you just meet the person, you will not really have that anxiety to take care of the person. So I don't know if anybody has a question for the speakers. Any questions, please?
I have a question. Um, Madam Natalie, how do we come about? How can we come about a project where we can work together and see how to assist the elderly people in communities? Or what are the strategies we can use to identify aside of our family members? Because when taking care of our family members, we do it with so much love and care, attention, but leaving our own comfort zone to address to assist other people, what are the strategies we can use to identify? Because most of the times people are afraid to go closer to the elderly people and assist them um, without a reward. So how can we develop a selfless service attitude towards elderly people, not who are not family members?
Okay, thank you so much, Madam Agnes. Thank you so much. Um, um, I don't know if Mrs. Nuki, please, if you give me permission, I'm going to share on the chat box a link to the website of my organization and also a link to our website so that through there you can go through, because what we do in DNC Memorial is that our main pillar is elderly care and support, which is the ECW. It is elderly care and support, and we have done so much, on elderly care and support. We have done distributions for elderly kids, elderly support kits. We have done that in the Northwest region, in Momo. We have done that in Mezam. So um, for us to do that, first of all, is the first point you need to know. First of all, you have to acknowledge that there is a problem here. When you have identified that there is this problem, now you have now to start. The second thing, you have to know what is that problem in particular. What is their point of need in particular? Mm, aside from the money problems, like you can say, okay, here in the Northwest or here in Mezam, we have elderly people, and we have seen that elderly people are being abused. And then now you're going down to ask yourself the next question: what form of abuse are they facing? Once you've been able to understand the form of abuse they are facing, then now you can already start coming in with a solution. Identification is never a challenge, because first of all, if identification is not really much of a challenge, because all you need to do is to do a community engagement. After you've done a mapping, you do a community engagement, you set up vulnerability criteria for the particular vulnerability criteria or criterion for the particular group of elderly people you want to support. That is if you have identified a niche. That is if you have identified a particular form of abuse that they are facing. We had mentioned financial, we had mentioned all the other forms of abuses that we had mentioned, financial being even the most prominent. There is another one. There is another one, which is a lack of access to resources and services, which means that they cannot access services, maybe medical services. So once you have identified that, then you can already know the problem. In DNC Memorial Foundation, what we've been doing is that we have been offering elderly support kits. So an elderly support kit will consist probably of a bucket, a blanket, and then probably food items, maybe just to boost them and keep them healthy. So there are just many projects. I have a whole project bank. I have written so many projects. If we can partner, I am so open to partner and to share ideas on how we can do this. By us, first of all, accepting that there is a problem, which is abuse, identifying the particular kind of abuse that they face. And then from there, we will know the last phase, which is the solution to it. How do we want to come in? Do we want to come in with financial assistance? How do we want to come in? Do we want to come in with training sessions for caregivers? How do we want to come in? Do we want to come in with maybe mobile clinic activities in the different communities that we have identified, so that we have elderly people come in just to do maybe simple screenings on BP and diabetes, or we can just do some distribution of medication, pain relievers, check for arthritis and all of that, because those are common phenomena that happen among elderly communities. you know so I don't know if I've been able to answer your question appropriately. If there is still any worry, I am very, very available to give more answers to that or to throw more light. Thank you.
Hello, Ma'am Natalie. Please, I also have a question.
Please ride on, madam. I'm bunking.
Okay, ma'am, please, I want to ask from all what you've just you presented. Yeah, that was great. It was exciting, but I have a small worry. I want to ask if I'm opportune to come across an elderly person, like say I have an elderly person in my family, and we've been discussed on sending that person to a caregiver's home. Do you really
Mm-hmm.
think the caregiver's home can provide with them all those services, all those things that you mentioned properly than when we do them back at home? Is it really advisable to send them to those caregivers home, especially here in Cameroon?
Thank you so much, Madam Ambunken. I had mentioned earlier that here in Cameroon and Africa in general, we still don't make use of caregivers, of caregivers, elderly people's homes. We still don't make use of that. We have almost none here in Cameroon. What people do is that you may have a nurse on standby that you pay, to come in while you are away during the day or out for work, and that nurse sits in to take care of your elderly person, and then when you're back, then the nurse leaves. So elderly people's home is still not something. It's still not active or vibrant here in Cameroon and in Africa in general because of many reasons. First, which is most important, because of the stereotype that holds that if you are, in Africa, in Cameroon, we believe that taking care of your mother or your father when they are old is a blessing unto you. So if you take your elderly person to an elderly person's home, that means you are rejecting your maybe your mother or your father or whoever it is old that you're living with. It's already some kind of rejection, if I can put in quotes, because that's the stereotype that holds, you see. So it is really not something that holds here in Africa. And our point, our direction that we are going to is the fact that since us here in Cameroon and Africa, we don't have elderly people's home. And even if we wanted to have, there are none. So we are forced to take care of our elderly people by ourselves. So if this is the situation where we are finding ourselves in, how do we go about it? And if we also understand that there are other elderly people in different communities around us who don't even have family members to take care of them, then how do we go about giving them care and support? That is where networking comes in. That is where we need to come together in synergy with different organizations offering the same form of support. We find a means through which we can help these people, which all boils down to us identifying the main form of abuse they face, identifying that there is abuse going on, then trickling down to identify the particular kind of abuse they face, and then we get down to the last stage, which is finding the solution. So that is how that step follows. In Africa, in Cameroon, I don't think I know of an elderly people's home. Probably it's in Douala or Yaoundé, but in the northwest region, there is none. So every help that we give comes from us identifying that there is a problem, identifying the particular kind of abuse, and then going in with the solution. Another thing too that we will need to do is that we will need to give an age limit for who we can call an elderly, owing to the fact that if we limit ourselves from 60 and above, I think that it's not really going to hold, because I have seen people who are 57, 58, and they are bedridden. And we cannot say such people are not old. So like it's just a whole lot. There is just so much in this particular sector of elderly care and support that needs to be taken into consideration before we can appropriately give support or care to elderly people whom we also call vulnerable people. I don't know if I've been able to answer your question, Mrs. Ambon King. If not, please, you can just rephrase the question again so that I may get it clearly and then I give an appropriate answer. Thank you and over.
You're welcome, Mom. Thank you very much. I'm grateful.
All right, please, Immaculate, in addition to what Natalie said, you spoke about bringing or taking an elderly to an elderly home or to keeping them at home. Okay. Firstly, culture is very important when it comes to the elderly. When you look at the generations, our generations now will be okay for us to take us to the elderly home if you get older. But we look at the generations of the 1950s to the 1960s, you get it? They say, no, you're abandoning me. You're letting me go. And remember that during my presentation, I spoke about the community approach and the institutional approach. So if you're taking an elderly to an elderly care home, that's really an institution, and there are laws that you have to follow. There are things that you have to do, because if you are bringing them, you have to support them financially. You have to support them in terms of their resources. But any other thing, we have to think about it. But when it comes to the community, you do what you have. Okay, it's more like anything I have to support them. So, and if you are trying to know why is it important, you have to ask yourself, the person who is old, the elderly person you're taking care of, how is your mindset, or in terms of their psychology, how is your reasoning? If you take someone who is really active enough to an elderly home, the person will feel bad in terms of the psychology, in terms of its way of expressing themselves. For example, if you take a normal person to a mad person's home, psychological home, the person will feel like you're abandoning me, and guarding the person. What the person be doing? Will start acting abnormal, even the person is normal, because our environment influences our actions and reactions to certain particular things. So you have to ask yourself this question: if I'm sending this person to an elderly home, would the person really be okay, happy with it? Secondly, as an individual, you are gifted, you have a mind to create. Maybe you create a center or like a community place, like in let's say if you live in a rural setting. I think the open spaces whereby you can invite the elderly. I think it doesn't take much to make them happy. They're just like kids, even if they're adults, but they go back as kids. You don't need much to make them happy. Bring them within their peers, offer them an opportunity to express and either food, anything, once a week or twice a week. You see how they're very, very happy, and every week they'll be looking up to attending to that gathering, and it makes them happy, and they are okay, they are fine. So you have to think about it from the community approach and from the institutional approach. So when we talk about the institutional approach of it, you have to know that there's a commitment to it. So what is important? The sanitation. Okay, Natalie mentioned about their bedridden. Do we offer them diapers, adult diapers? Do we provide them? Because they're institution, you're not there. They can do whatever they want to do with the elderly. They don't care about it. If you're taking your elderly person to an elderly home, the sanitation is not really their priority. They will contact a disease that will be very difficult for you to take off. And if they are sick, it's not for you to take. It's not them to take care of the elderly. You have to take off. You have to pay for their bills. So think about these institutions. Think about these things if you want to transfer them to an elderly home. Another thing we'll think about is the ability to accommodate them. You have to talk to them about it. Tell them what's happening. If you tell me that Pauline, if you're taking this path in your career, not be good, do you think I'll go for it? I won't go. Or Pauline, if you're talking about elderly care and you're not yet I'm talking about elderly care, I'm not yet an elderly. When I think to that age, the way I will react, the way I will respond to it will be different. And for you to be able to identify in regards to Agnes, your question, able to identify these elderly, most of them you can find them in the rural setting, not in the urban setting. Those in the urban setting live with their family, with their friends. For them to have access to this organization is quite difficult because their mobility is limited. They have to take permission for going out. They have to, But for you to identify, you have to go to the rural communities. When you go and ask them, why are you staying alone? What's happening? They will tell you that living with this person, the person takes care of the. they're just like children. So for you to identify them, you have to go to the community, you have to go into their homes, you have to be with them in their homes. You have to create awareness about who you are, what you are doing for them. And remember that they tend to be children. So they tend to want to be comfort, they want to be okay. I know they are adults, but they are more the adult, they're like the child form of adultism, like let's say so. So we have to go to the community and ensure that these people are there. I know that when it comes to the community, what they care about is their food. They care about is them able to move around, to take care of themselves with the way they can. But as also as an individual, also as an organization, we know sanitation matters a lot to them. Their diapers or their food matters a lot in terms of their healthcare. It matters a lot. Do we keep them in contact with the healthcare systems, or do we keep in contact with the healthcare centers around them? Do we say, okay, no, go to the hospital, I'll pay for your bills? You know, all these things are ways in which, if you are trying to support this elderly, you have to think out of the box. You have to make sure think they say, okay, if I'm the person, what will I need? What should I do? Or how would it how should we approach it? And regards to the reporting system, in regards to the reporting system, some of them are not aware that they are being violated. You know? So it's quite a challenge. It's for you to, when you listen to their stories, you know how, you know if they're being violated, if they're being violated or not. So in terms of reporting, that's really a gap. That's really a gap in terms of let's say in Cameroon. Let me use Cameroon in particular. That's really a gap, unlike in the Western system, in Western organizations or Western countries. It's really a gap. So as an organization, we have to work towards that in regards to the reporting of the elderly abuse. Thank you. I hope I've taken a lot of your time.
Thank you very much, ma'am. Madam Loom, I have a question. Considering the fact that elderly people have one of their major difficulties they face is lack of finances, don't you think they should be offered some level of special treatment, maybe free checkups, free screening, or or maybe giving them measure items that they might need, giving them measure items that they might need to take care of themselves? That's my question.
Thank you very much, Mrs. Nuki. Thank you very much. That's a very important question. It is important for us to always identify what they actually need. Now, in your case, you're identifying that they have health challenges, and and also the form of abuse they face is financial. Now, if we have to look at it from a generic point of view, what do elderly people actually need money for? Because you know, when you've gotten to that age, I don't think you even need money to buy new clothes. You don't even identify, you don't even realize that your clothes are old and worn out. The diapers you wear, you don't, it's not your money that buys, you know, your caregiver needs to provide that for you. So if we say that there are elderly people who have a financial challenge, we should understand, we should first of all even start thinking of, oh, let's say we come here and we carry out a project on catch voucher assistance to give money for food to elderly people. And you come to a community and you're giving, say, 100,000 to 300 elderly people, and you're giving it to the elderly people themselves. Say you meet a mommy of 95 years and you give her 100,000, what do you think she's going to use that money for? Yes, it is very, very important. Yes, they do need money. But like I mentioned earlier, that everything or most of the projects that we as organizations we may want to carry out to support elderly people, a lot of times it goes through their caregivers, who in most cases are their family members, the direct family members who stay and care for them. There is a project that I have written just to tell you importance of healthcare for elderly people. Yes, it is possible that they may not be able to afford medical services or afford medication. So, if we identify this as an organization and then we are looking at a possible way to come in to support, you know, what we can do as an organization instead of this is just my opinion. It may differ from many other opinions or suggestions, but in my opinion, instead of giving them money because we have identified that they have a financial challenge, I think that we should provide food items, non-food items, and in case of health, if we are coming in to maybe support their health, I think that we should do some kind of mobile clinic interventions. So which means that we put together a team of doctors and then we identify a particular community. We send out communiques to keep the community on alert that we are coming on this day with a team of doctors and mobile clinic. We are screening on maybe BP, diabetes, arthritis, and we'll be offering free medication. And we are offering and this service or this mobile clinic service will run from this time to this time. And we are looking at elderly people within this age range. I think that is how we can come in, to support them or to support their health if we have identified that that is the challenge. So I think that is how we can come in. Also, if we identify that aside from health challenges, there is also a need for food, then we can already start looking at what kind of food we want to get them. We want to get for them, owing to the fact that there are many elderly. There is a tendency that elderly people already start suffering from diabetes, from BP, which may also restrain them from eating some particular kinds of meals. If we take that into consideration, then we already start limiting ourselves on what we can provide. So you mentioned health and finances. Sorry that I'm already drifting to something else, but let me just bring us back. So if we are trying to offer some kind of health service, I think that if we do mobile clinic interventions, then it's really going to be very helpful instead of offering them finances like you asked. Probably we can use those finances maybe to offer them some kind of food FI, and we can also offer NFIs, say blankets. Instead of giving them the money directly, we can just supplement like that. Thank you, Mrs. Nuki.
All right, ma'am. Thank you very much. Perfectly understood. Okay, I think we are almost rounding up. Do we have any feedbacks? Anybody? Yes, Madam Lu.
Thank you so much, Miss Nuki. I don't know if I was granted permission to share the link of my organization's website on the chat box and LinkedIn address. I don't know if I was granted that, but I have just gone ahead to share. I don't know if it's against the policies. If it is against, I don't know if we have a format of deleting. I just wanted to highlight that.
Okay, ma'am. Thank you very much for sharing.
Okay.
Madam Pauline has to answer that. Madam Pauline, are you there?
I'm very sorry. I have just gone ahead to share. Let me unpin and oh my god.
No, I think it's okay. It's okay, Madam Lu. That's why we
Okay.
have you on board to share with
Okay.
you via network what you do as well, and
Okay.
maybe we're creating a nexus with you. Say since you're in Bamenda and we're here in the southwest and the littoral region, maybe we can have a
Yeah.
project in the northwest. So it's okay. I think it's fine.
Oh, thank you so much. Thank you so much, Madam Pauline. Thank you. Thank you.
Thank you too, ma'am. Your presentation was wonderful. I learned a
I
lot.
had a better time. I had a better time sharing experiences here. I think that this is the first time. This is the first time I am talking in a webinar on elderly care and support. A lot of times I've done presentations on what I studied in school, which is gender. So I have had so many presentations on that. So me coming in to talk today about elderly care and support, which is a niche for my organization or foundation, I don't take this for granted. I am really, really honored. The discussions were very, very interactive and very, very insightful to me. So thank you so much. I pray and I hope that we keep the network going. I pray that we have other opportunities like this to share and also to advocate for the better life, better health, better well-being of adults. Thank you so, so, so much, Wem'Afrika. Thank you.
Thank you too, ma'am. Just to add, we are working on a project since the 16th will be Elderly Abuse Day. We are thinking of going to an elderly care home to support them with basic items they might need. So we are looking forward to that.
Okay, thank you very much, Mrs. Nuki. I just wanted to ask, I haven't been able to identify even one elderly people's home anywhere around Cameroon. And I don't know if they exist. If they do exist, I will be very, very happy if you can share with me where such a home is, location, so that I can always go to see how it works around it. Thank you.
Sure thing, ma'am. I will share that with you. I know of Laughter and I know of another at Simbok. I'll give you the exact location in your inbox if you don't mind.
In addition, I think Shanta Biazi 2 years ago, she created an elderly home in Yaoundé. So I've forgotten the name of it. I'll send the name to you. What you can do to identify elderly home, go to the Catholic. Are you Catholic? If you're Catholic, you can ask the priest. Because most of these elderly home are mostly managed by the sisters. I think that's your calling for poverty, So ask the Catholics, and I think you could also look into, I don't think international hospitals. Maybe hospitals too. If you have a friend who works in the hospital, you can ask them if they know any elderly care home. I'm sure they are around. And maybe if you're in Bamenda, another approach you could do is you could discuss that with the community head, to give you an access to, is it to a hall or to like an open space where you could invite the elderly. You can host activities like once a week or twice a month. You see how they'll be eager to come to share their experience, to be okay with your friends, and involve them in games activities. Through that, maybe you might know someone who knows organization, they can get information.
Thank you
Alright,
so much, Madam Pauline. Thank you. It's very helpful information you've just shared. Thank you so much.
Okay.
okay. Veronica, I don't know if you're there. I don't know if you can enlighten us on your project. On your project you'll be executing next week on child abuse. Are you there? Veronica, are you there?
Vero, you're muted.
She's
Could you just move ahead, please, so can
all right. I think we have come to the end of the session of today's session. And I want to thank all the speakers and everybody who took out time to attend. It was worth attending on my side based on my observation. I really learned a lot. Thank you very much.
Okay, on behalf of the Wem'Afrika team, we thank you, Natalie, for being part of our part of our program, because we hold webinars every month, and we'll talk about different topics of our areas of focus. So this webinar is being organized by the humanitarian department. Next week or the coming weeks, we'll have other webinars hosted by the different departments. So thank you so much. It's a pleasure having you on board. It was a pleasure sharing the stage with you, or sharing this platform with you. And thank you to everyone who stayed back. Agnes, Immaculate, Oti, Jemina, Vero, and I can Bisanji. Yeah. Thank you all, and do have a lovely evening.
Thank you very much, ma'am. Goodbye to everybody.
Bye bye. Bye, everybody. Goodbye. Have a lovely weekend.
Have a lovely weekend.